children, to expose the elderly to COVID-19 patients in the close proximity of home. And yes, we have dispersed Kenya shillings 5 billion to the counties in order to assist them increase their healthcare capacity in view of this pandemic. But to build the necessary health infrastructure for such an undertaking requires time. We must get ahead of this pandemic by creating lead time. So therefore, fellow Kenyans, while considering the possibility of de-escalating the containment measures in place and conscious that health is a shared function between the national and county governments, I have convened today an extraordinary session of the National and County Government Coordinating Summit on Wednesday, the 10th day of June, to consider the following salient matters. First, to review the effectiveness of the containment measures we have taken so far, those that have been rolled out to break the chain of transmission of the coronavirus disease. The second, to secure the undertaking of every county government to deliver isolation facilities with at least a minimum of 300 beds. And thirdly, within 14 days, develop time-bound protocols for progressive reopening of the economy. Fellow Kenyans, with my colleagues and having applied our minds to the different scenarios presented by our experts, I have reconciled myself to the fact that to open or not to open is not a dilemma between a right and a wrong. It is a dilemma between two rights. And because of this, and fully cognizant of the irreducible minimum given by our experts, and in keeping with the advice of the National Security Council, I today hereby direct an order as follows: that the cessation of movement into and out of Eastleigh area of Nairobi and the specific limitations in force with respect to the Old Town area of Mombasa that is currently in force shall lapse at 4 a.m. on the 7th of June, 2020. That in view of the successful containment of the disease in the counties of Kilifi and Kwale, the cessation of movement into and out of the two counties that is currently in force shall also lapse at 4 a.m. on the 7th of June, 2020. 3, that following stakeholders' consultations in the education sector, the Ministry of Education, jointly with the Ministry of Health, issue and publicize guidelines on a gradual and progressive return to normalcy in the education sector by the third term, that is, from the 1st of September 2020. Further, that the Ministry of Education shall announce the new school calendar by the middle of August. As you are aware, on Madaraka Day, I did direct that the Ministry of Interior, the Ministry of Health, hold consultations with interfaith and religious organizations. So today, we state that following these consultations, within 7 days of today, the Ministries of Interior and Health will constitute an interfaith council to work out modalities and protocols of reopening of our places of worship. 5, that in the meantime, the ban on all forms of gatherings, including but not limited to political gatherings, social gatherings, including bars, be and is hereby extended for a further 30 days. That due to the evolving nature of the disease globally, international travel restrictions are hereby extended. In the meantime, the Ministry of Transport is directed within 7 days from the date hereof to engage all key stakeholders and develop protocols and guide resumption of local air travel. That due to the increase in patterns of infections, the cessation of movement into and out of the Nairobi metropolitan area, Mombasa, and Mandera be further extended by 30 days. That the nationwide dusk to dawn curfew, currently in force until today, the 6th of June 2020, is extended for a further 30 days. However, the commencement time for the same shall be varied from 7 p.m. to 9 p.m., with the end time for the same being varied from 5 a.m. to 4 a.m. Therefore, effective 7th June 2020, the nationwide dusk to dawn curfew will run from 9 p.m. in the evening to 4 o'clock or 4 a.m. in the morning. This variation should enable Kenyans to have a full workday schedule. Fellow Kenyans, recognizing the negative impact of the COVID-19 is not limited to healthcare. As I have said before, my administration has made targeted interventions to protect our economy. At the onset of the pandemic, my administration injected 216 billion back into the economy through tax refunds, rebates, and waivers. In our second phase, we have further rolled out 53.7 billion under an 8-point stimulus package to reinvigorate our economy. Each week, the government is distributing approximately 300 million shillings a week to the most vulnerable members of our society, on top of Kazi Mitaani, which is also being extended to cover more counties. Also on Madaraka Day, I did announce that a further Kenya shillings 2 billion would be injected into the hospitality industry to cushion those in that industry from the effects of this pandemic, and modalities of how these resources will be shared are to be released next week, with priority given to ensuring that our workers in this sector are assisted to retain their jobs. Finally, I wish to assure each and every Kenyan that I shall do all that is necessary to limit the negative effects of COVID-19 on our people, our economy, and our way of life. Rest assured that my administration will continue to work to restore our lost livelihoods, our lost opportunities, and our lost wealth. As I have said before, I continue to call upon all Kenyans, particularly landlords and employers, to put people before profits during these testing times. Permit me to close by saying what I have always said, that this disease is beatable if we work together. Listen to and apply the regulations, the guidelines and protocols issued by the Ministry of Health, and let us all keep our eyes on slaying the enemy. Thank you, God bless you, and God bless Kenya. I'll take 2 questions, and then I will leave the experts who have been advising us to continue with the rest of the session.
Good afternoon.
Afternoon to
my
you.
Name is Gashuri from
Yes,
Citizen
Gashuri,
TV.
I know you.
How are you, sir?
I'm well, and you?
Very well.
Good.
I'm sure you've seen the expectations, many of them from Kenyans who are hoping that you will do something to release them. But be it as it may, the main question is the question of sustenance, livelihoods. People are complaining, people are lamenting that they are no longer able to sustain themselves. Is there a possibility of expanding the list of beneficiaries from the money that is being given every week to cover even those who are not initially listed among the most vulnerable, because there seems to be an enlarging group of people in dire need to sustain their livelihoods? Thank you.
Like I said, in full recognition of what you have said, Gashuri, this is why we have been releasing, like I'm saying, approximately 300 million shillings. And this is over and above the 10 billion that we release every year, no, the 30 billion, sorry, that we release every year to the most vulnerable in our society. And I do agree with you that there are some sectors, especially the hospitality sectors, the hotels, the small restaurants, the bars, and so on and so forth, that have been closed, and a number of people in those areas have also been affected. That is why on Madaraka Day, we said that we are expanding that program by a further 2 billion shillings in order to be able to capture those people in those sectors and to also ensure that we are cushioning them during this difficult time as we work towards reopening. But ultimately, we have no choice. We will do what we can to continue to support livelihoods. We recognize that that's where the challenge is. And we will do what we can to support all our citizens, especially those most affected. And we will continue to do that. So I want to assure you that we have that in mind and we are taking action on it. And as I've said, the Joint Ministerial Committee that was put together to make consultations with those in those most seriously affected industries will, within a week, come out with the guidelines of how those resources shall be released. And like I'm saying, this will go specifically towards ensuring that these establishments are able to keep their workers on payroll while we go through this difficult time. Secondly, as we have also said, the reason for expanding the curfew time is to ensure that we now have Kenyans who are able to go to work and have a full day's work and still have adequate time to go home. This now will enable Kenyans to be able to work a full shift, unlike the half shifts that we are into before. Now you can have a full day's shift. You can work from 8 to 5 and still be able to get home on time, thus expanding the number of working hours, and therefore enabling more and more Kenyans to be able to resume their normal duties and activities in our economy.
Jina langu ni Nancy Okware kutoka KBC.
Nancy
Okware kutoka KBC. Na swali langu kwanza kabisa, umesema ya kwamba masharti katika kaunti ya Kwale na Kilifi kwa sasa hivi yameondolewa. Je, kama serikali mnahisi kwamba mmefanya vya kutosha ili kuhakikisha kwamba hawa watu wanapotoka na kuenda katika kaunti nyingine wamepimwa, ili kuhakikisha kwamba pengine kuna mmoja hakuwa amepimwa, lakini unasema ya kwamba Kilifi mmeweza kumaliza ugonjwa ule pale na watu wote hawajapimwa?
Hatujasema ugonjwa umeisha.
Yani mmeweza,
lakini tumesema ya kwamba katika kaunti za Kilifi na Kwale ugonjwa umeanza kupungua. Na kwa sababu umeanza kupungua, tumesema tunaweza sasa kufungua. Lakini vile nimeita mkutano wa baraza la magavana wa taifa letu, gavana wote 47 governors. Nimeita huo mkutano on Wednesday kwa sababu mambo ya afya na vile tutatembea na vile tutaruhusu watu kutembea county to county, lazima magavana wawe on board. Lazima waweke mikakati, kila governor kwa county yake, ile itatumiwa wakati watu wanatembea. Watapima temperature namna gani, watajua wagonjwa ni wagapi. This is why tunataka kufanya hiyo program pamoja na wao, ndio tusaidiane, kwa sababu haja yetu ni kuhakikisha ya kwamba hatutoi ugonjwa kaunti moja kuupeleka kaunti ingine. Na ndipo unasikia tukisema kama ni hapa kwetu Nairobi, sasa pale tuko hapa ugonjwa unaenda juu. Tukiufungua hapa, na hakuna inchi ambaye imefungua wakati ugonjwa unapanda. Na kwa kaunti yetu ya Nairobi sasa ugonjwa unapanda. Katika my states mbali sasa tunaona increased number of cases. Na ndipo tunasema Nairobi sio kama Kwale na Kilifi. Kwale na Kilifi ugonjwa umeanza kushuka. Hapa Nairobi unapanda. Na ndipo unaona tumefungua kule ambapo ugonjwa umeanza kuteremuka, na tumebakisha cessation kwa pahali ambapo ugonjwa bado unaendelea kwenda juu, kwa sababu hatutaki kueneza huu ugonjwa kwa kaunti zile zingine. Umesikia hapo nikisema hapo awali, tukifungua kabisa vile wengine labda wangependa tufanye. Kulikuwa tu case moja ambaye ilitoka hapa Nairobi ikaenda mpaka Siaya. Hiyo case moja imesababisha watu wengine 8 wapate ugonjwa. County ya Siaya wako na vitanda ya isolation 10 peke yake. Sasa jameni, tukifungua hivyo wengine wanataka tufanye, ugonjwa uendelee kuzidi Migori na Siaya, na hawana vitanda vya kutosha. Si hiyo ni kulazimisha wale ambao wako na ugonjwa sasa warudi manyumbani kwao. Wakirudi manyumbani kwao, hawa ni wazee wetu, wa mama wetu na watoto wetu ambao pia wataambukizwa na hizo virusi. Na ndipo tumesema tunataka huu mkutano wa Wednesday, kwa sababu tayari tumeallocate bilioni 5 kwa county zetu. Tunataka tukubaliane na wao ni mikakati gani wataweka, na tunasema ukitaka county tufungue, lazima uwe na a minimum capacity ya vitanda 300, zile ambazo zaweza kutumika ugonjwa ukipanda katika kaunti yako. Kwa sababu tukikataa kuweka hiyo mikakati, umesikia yale nimesema hapo, idadi ya wananchi ambao twaweza kuhatarisha maisha yao tusipoweka hii mikakati ambapo tunasema. Nimesema sana, haja yetu sio kuumiza Wakenya. Mimi mwenyewe nilikuwa nadhania ya kwamba tutafungua hata zaidi ya yale ambaye tumefanya hapa leo, lakini ni mjinga ambaye hasikizi kutoka wataalamu wake. Wataalamu wetu wametuambia kufungua ni makosa. Wataalamu wetu wametuambia kufungua ni kuhatarisha maisha ya Wakenya wametuambia ya kwamba kufungua, tukifikiria tuwasaidia uchumi, mwishowe ni uchumi tutakuwa tunaharibu. Wacha jameni, tusaidiane vile nimesema, vile Francis amesema hapa, tuone ni kwa njia gani tutaweza kusaidia wale ambao wameumia zaidi. Wale ambao wanaendelea kazi tutawazingatia kwa njia gani? Wale wameumia zaidi tutafute mbinu zote ambazo tuko nazo za kuhakikisha ya kwamba tumewasaidia pahali ambapo walipo, lakini sio kuwapeleka pahali ambapo maisha yao yatakuwa hatarini. Na ndipo unasikia tukisema tumeconsult hata na wazazi, tumeconsult na walimu, tumeconsult na religious groups juu ya mashule, na wote wamekubali ya kwamba haistahili tufungue mashule yetu sasa, kwa sababu tukiyafungua, hiyo ni kama kufungulia virusi vianze kusambaa zaidi ya vile ambavyo inaendelea kwa wakati huu. Kwa hivyo, Wakenya wenzangu, tunajua ni muda mgumu. Nimeona meme mingi ambazo mumetumatuma huko, sijui ati Freedom Day, Independence Day. Hii sio mambo ya independence, hii ni mambo ya maisha jameni. Hatufanyi hii kuumiza mtu yeyote. Jamani, tunafanya hii kuhakikisha kwamba tumelinda maisha ya wananchi wetu. Jameni, afadhali uwe hai ndio uweze kukula hiyo happy ambayo unatafuta. Lakini ukiishia hiyo happy ulikula siku moja, iwe ndio itakupeleka kwa kaburi, sioni haja. Wenzangu, tutulie, nafasi bado itakuja. Mungu awabariki, Mungu awalinde. Nataka sasa niwaachie katibu wa Wizara ya Afya Susan Mochache aendelee pamoja na hawa wataalamu ambao wako hapa. Dr. Amoth yuko hapa na wenzake. Hawa ndio wako na ujuzi. Sisi tumeshinda siku mzima tukiwauliza maswali, na tumechukua yule mwito ambao wako nao. Sasa sijui nyinyi wengine labda pia mko na maswali kama sisi tulikuwa na maswali. Wako hapa waweze wawajibu. Yangu ni kuwauliza wenzangu wa Kenya, let us have patience, let us trust in God, we shall overcome, na tutashinda hii virusi na Kenya yetu itasonga mbele. Mungu awabariki nyote, Mungu awalinde. Asanteni sana.
Thank you. Mask, yeah? Nafikiri tumesikia vile ambavyo Mheshimiwa Rais ameweza kusema, na sisi tukiongea kama Wizara ya Afya na washikadau wote wa afya, tunaona kwamba hii imekuwa ni jambo gumu sana katika kuamua, lakini imekuwa ni lazima kupitia kwa yale ambayo afya nzima, ile fraternity ya afya imeweza kuangazia. Hapa tuko na wawakilishi wachache wa washikadau wa afya, wataalam, wauguzi ambao tumekuwa tukijadiliana nao, wale ambao huwa tunakutana nao muda kwa muda, wako karibu zaidi ya 100. Na tuliongea juzi, tukajadiliana kabisa paka usiku, tukijiuliza ni tutaweza kupeana advice gani kwa serikali kuhusu maneno ya COVID na restrictions. Kwa hivyo yale ambayo yamesemwa ni maoni ya watu wote wa afya ambao wameweza kuongea na kujadiliana, watafiti, wataalam na wote. Kwa hivyo sasa mimi ningependa kuchukua nafasi hii kuwashukuru kwa sababu wamejitolea na wakasema inafaa tuendelee hivi, na serikali na Mheshimiwa Rais amefanya kitu cha maana sana, kwa sababu sisi tulikuwa tunaona kwa kweli kupitia kwa vile tumeona katika nchi tofauti tofauti na utafiti wetu kwamba Wakenya wengi wangeweza kuumia kama tungeanza kuanza kufanya zile lifting of restrictions. Kwa hivyo kwa hayo machache ningependa kuwakaribisha hawa wakurugenzi wetu ambao
pia wana represent wengine wote katika sekta ya afya waweze kujibu maswali ambayo labda mungekuwa na Wakenya wangependa kujua kwa nini hatua hii imechukuliwa siku ya leo. Asanteni. Labda nitaanza na Profesa Anzala ambaye nitamuomba aongee kidogo kwa nini imebidi afya iseme kwamba huu ndio mwelekeo ambao unafaa. Profesa Anzala.
Yeah, thank you so much, Madam PS. Really, the decisions that have been made, the advisories that have informed that decision are actually information that we have all put together, those who have been working in the National Task Force, to really look at the situation we are in now as a country. How well are we prepared in terms of managing this outbreak? Not only in Nairobi and in Mombasa, but how well are we prepared across the country? So I know that decisions were difficult, exactly as our president said, but then with those decisions made, I'm sure that we shall do all that is necessary to ensure that in the interim period, a lot of these things can be put in place so that we can actually be able to realize the kind of things that Kenyans are yearning for. It is not easy, ladies and gentlemen, but I think those of us who are sitting at the National Task Force are actually equal to this task.
Maybe I would want to ask the professor to talk about the phase of the pandemic, because any pandemic has got various phases. And right now we are in a very different phase, and why it was important that the decisions that were made today were made in view of the cycle of a typical pandemic.
Yes, the understanding should be that an infection of this nature that is new, realize that SARS-CoV-2, the virus, and COVID, the disease, is only maybe 6-7 months old. You know, having been identified, discovered in Wuhan last year, that is December. So the natural history is that it is a cluster infection. It is spread, you know, through contact, very close contact, breathing, coughing, sneezing, you know, touching surfaces that are contaminated. Through that process, someone gets infected. Through the process of infection, within 6 to 7 days, people begin to come down with symptoms. Then eventually, people begin to recover. And we know now within 14 to 21 days, individuals do recover. The virus is not detected. So the idea that is a cluster means that you are actually not aware of who is infected within the community. And hence the reason why all the measures that have been put in place are a clear indication there. Then there is the level of where people begin to get infected. In Kenya now, we are actually seeing an upward trend, meaning that we have not peaked yet. And one of us here is going to talk about the numbers. We have not peaked yet, and even our president himself alluded to those numbers. So we cannot, under these circumstances, do anything else other than maintain the measures that we have been put in place. And then when we peak, it does not mean it's also the end. It just means that we have reached a peak where a lot of us have been infected, and to a large extent, some of us already have some ability. We are less susceptible than we were before. Then the trend begins to go down. And even when we peak and the trend goes down, it's going to take a period of time, maybe 5 or 6 months, for this infection to subside. And during that period of time, a lot of us will actually be susceptible, and eventually the infection will go down. Our interest is to ensure that we flatten that curve, as we have always been saying, so that we don't overwhelm the healthcare system. So that's what we have been doing. And you can actually see that those measures that were put in place very early, very quickly, and were adhered to by most Kenyans have enabled us not to go the way the modeling had shown. We are way, way down here. But if we do anything else that will interfere with that, then we shall go back to what actually the model had actually predicted. So this is the time not to relax any of these measures. It's the time to tighten these measures to ensure that we maintain that process. Our healthcare system is not totally overwhelmed, and at the same time, we manage and shield those of us who are vulnerable. Thank you, PS.
Asante Professor. Professor is actually an expert in viruses. Yeye ni mtaalam juu amesomea maneno ya virusi, kwa hivyo akituelezea lazima tuchukue very seriously ambayo anasema. I think the other thing I can add that I heard from the experts, and they will speak, is that one of the reasons why Italy got to where it did is because a town that was an epicenter lifted the restrictions of movement, and that really caused a serious spread of the disease. Na yale ambayo yalifanyika katika nchi hiyo ni mambo ambayo sisi wote tunajionea. And so because Nairobi is an epicenter, opening Nairobi up means that we risk to take the virus to other places in the country where the virus is still low or even non-existent. So looking at those examples of other countries has informed some of the decisions that have been made today. And I want to also invite Professor Karanja from Jomo Kenyatta University to also speak as an expert. And then we will invite questions. I can see somebody wants to, in fact, maybe you can ask your question and Professor Karanja can answer.
My name is Gloria Milimu from K24 TV. My question is directed to the Director General for Health, Dr. Patrick Amoth. The other day you announced plans for the country to leverage on home care, on home care-based isolation. So my question is, WHO says the decision has to be based on an assessment of the patient's home. So in the event the patient tests positive during the test, the mass testing we've been seeing, will healthcare workers have to assess the home first before the patient is allowed to proceed on home care-based isolation? And in this case also, WHO recommends that the patient should be placed in a well-ventilated room. We know that some of these patients, given the numbers we've reported in the past, come from the slum areas where people live in single rooms, as much as 6 people. So how will this be possible? Are there plans to isolate them as much as they will be asymptomatic in a facility? And then how will this waste be collected, the infectious waste from the home care-based isolation?
Thank you, Gloria. You are very right that WHO recently approved home-based care guidelines for use. And we have customized the guidelines locally as a country. And the guidelines we'll disseminate the guidelines to the counties on Monday. It will be based on a strict criteria, based on assessment by the healthcare workers to be able to see whether that particular person or individual fits the bill for home-based care. So home-based care does not apply for everybody. We will be able to assess your home, how many rooms you have, how many people do you live with, do you have anybody with comorbidity, do you have very young children, do you have a caregiver who can be able to be trained to be able to support you during this process. All those are captured in our home-based care guidelines, which we are going to disseminate on Monday. But the most important thing is that not everybody will qualify for home-based care. It will be based on a risk criteria based on an individual person's assessment. Thank you.
My name is Rita Tinina. I have 2 questions. One of them is that KEMRI did a genetic makeup of COVID-19. What does that tell us? And is it useful in the containment measures?
Yeah. Thank you so much, Nina, for the question. A new virus, when it enters a new population, the tendency of that virus is to mutate because of immune pressure. So definitely that is the beginning of understanding the virus. We know very well from the information that we saw on the sequence that that virus was from Europe. So sequencing makes us understand it. Sequencing also gives us a sense that when vaccines are made, and vaccines are being made, are they actually appropriate for the kind of sequence that is actually circulating? So that is the first sequence. We shall continue sequencing because we know very well as time goes by, these viruses will actually mutate. So that is a good science because that is a kind of science that will inform what we do with this outbreak, that will inform what we shall see, for example, in Mombasa, what is a strain in Mombasa, what is a strain in Nairobi, what is a strain in Western. So this information will keep gathering and will inform the kind of decisions we shall make. So that is important for understanding immunology. Sequences are also important for understanding the vaccine development. Thank you.
And following up on that, right now the country is still struggling to flatten the curve. Now that the measures have been extended, your projections, what are you looking at? Are we going to continue with an upward trend? Will we be at a plateau at some point? Will there be a dip? And if so, at what point?
Thank you very much, Richard Tinina. When you talk about extending the interventions and the period of restrictions, what you are doing actually is to make sure that you extend the period within which the cases arise. Ideally, when you start with a population of susceptible individuals, if you spread them over a prolonged period of time, then the rate at which the number of new cases come cannot overwhelm your health system. So what we are looking at here is a possibility of extending the interventions and thereby reducing the rate at which the number of new cases come. And when you do that, if you look at our current case fatality rate, the number of people who are dying out of those that are detected positive, it's going to around 5%. If you are able to extend this, then our healthcare system is not overwhelmed. Those that require critical care services are able to access that. Those that are able to access the critical care, when they access that, therefore you reduce the rate of mortality. However, if you lifted the restrictions and the curve the numbers surge within a very short time, what happens is that you overwhelm the system. And therefore, you will move our case fatality rate from the current maybe 5% to what you saw in Italy, to what you have seen also in a country like Spain. The other thing is this: as you prolong the duration of interventions, the curve goes down and you also improve on your preparedness. The enhancement of resource mobilization and, for example, enhancing facilities within the counties. We know that that is the next battlefield, counties. So if you are able to do this, then it gives us preparedness and reduce the rate at which you get adverse health outcomes out of infected cases. Eventually also, you give chance for science, for people who are inventors to come up, for example, with vaccines. And therefore, this is going to work well for all of us. Therefore, opening up of areas and lifting restrictions should be always guided by when you have a turnaround on the numbers. When you have the curve going down, then you can think about opening up. And I believe that we are going to get updates through the NERC from time to time. Thank you very much.
Maybe just to add to that response by Professor Karanja, I think one of the things that His Excellency the President mentioned is that with every amount of increased contact between people, you're likely to see a small increase in numbers of people who fall sick or die. But it doesn't have to be that way. I think whenever there's an opening up, it calls for a higher sense of responsibility by everyone. So now more than ever, every Kenyan must take responsibility for prevention. That means that this is a time that you want to avoid crowds, you want to leave your house with your mask, and you want to follow all the basic hygiene measures. Remember, those have not been lifted. So for us to continue with this trend of a lower rate of infections and deaths, we must continue to adhere to all the prevention measures that have been mentioned previously.
Gloria Milimu, K24 TV. As the government plans to reopen schools, how will we avoid surges in infection given the infrastructure we currently have in the country? Then again, will the students and teachers be tested regularly? And will all teachers, perhaps in the event of boarding, be required to live within the school compound? And then another last one, a scientific one. There are 2 research studies that have shown the benefit of receiving infusions of blood from COVID-19 survivors. And this was done in China, where 10 patients received plasma infusions. In terms of just scientific developments, where are we as a country? Are we also looking into some of these things we are learning from other countries?
Well, thank you very much for those questions. I'll answer the first one around reopening of schools. I think one of the challenges, and I think you've pointed out this very well, with opening of schools is we know the sort of conditions that are in many of our schools. So for one, there may be crowding because of having many children in class, but it's also difficult to get children to constantly adhere to some of the measures that we put in place for prevention. Which means, one, I think it was pointed out about the timing of the opening. You want to really time this opening to a time when you're reporting a fewer number of cases, which means by then, either some people have gotten infected and may have some measure of immunity, for example, but also that the people who have infection and can transmit to children are also fewer. When the opening happens, then there are certain measures that will have to be put in place. And I think this is something that the Ministry of Education is also looking into. One would be around how to ensure we don't have crowding. So there may be different strategies around how children go to school, having a phased approach as opposed to opening everything at once. So that would be key, ensuring that there's flowing water, that children are taught to wash hands, but that parents also take responsibility to ensure that their children understand why some of these measures are important. So it will not just be a school responsibility. That responsibility starts with us as parents. That as I prepare my child for a time when schools are opened, one, I understand why do they need to wear a mask? And does my child understand why they need to wear their mask? Does my child understand why they need to wash hands regularly? Have we trained the teachers around how to manage the children in school, how to implement some of these physical distancing and hygiene measures within the school? So those are things that will need to be put in place so that our children can safely go back to school. Those are questions of convalescence.
Yes. What you're asking is the use of what we call convalescent plasma or convalescent serum. But it is not proven yet, like many other drugs that have been tried in the management of COVID. But what it also means that we locally must also understand our own natural history before we can even try it out. And what do I mean by that? What I mean is that for those of us who get COVID and recover, do we have antibodies within ourselves? Because that's what they are trying to use. What they are trying to use is antibodies that have been elicited during the infection. So first of all, there must be recovery. The patient must recover. We must find out, after that recovery, is that individual having sufficient antibodies in the system? That's number 2. Number 3, are those antibodies able to neutralize the virus? That is another additional to it. So there is work to be done. That has been tried, but it has really not been proven. But certain things are actually going on. But it is an experiment that I would actually say that will actually not be the direction we would like to take. Really, our direction is to understand the natural history and to collaborate with others out there to ensure that we make a vaccine against SARS-CoV-2 and COVID. That will be the kind of science that we would like to be involved in. Thank you.
That is just to say in a nutshell that there's still no cure for COVID-19. There are very many things that are being tried by scientists, but so far there's nothing that has worked that we can put to the people on the table that this can cure the disease. Thank you.
That's the end. Unatazama Mwangaza TV, tumaini lako.
Taasisi ya Jewel